The new controversial Texas abortion law only applies to people in Texas.
But it's actually impacting women here in Washington. Steve Bunin reports from the King 5 newsroom.
Yeah, the new law basically bans abortions after 6 weeks in Texas. And just within the last 7 days, one federal judge there has already deemed it unconstitutional, took it off the books. But then a federal appeals court put it back in, reinstated it. So as the legal back and forth continues, women here in Washington are being affected. I spoke with Dr. Sarah Prager, an OB-GYN at UW Medicine. She told me from the time the law was signed into action back in May until now, she is seeing a lot more anxiety amongst her colleagues and patients. And more to the point, her clinic is making more appointments already with women from both here and from Texas.
We're already getting calls at clinics here in Washington state from patients in Texas who need to leave the state of Texas in order to get care here. I'm also seeing patients of mine coming in and saying they want to talk about contraception and get long-acting contraception because they're moving to Texas.
Dr. Prager says a big concern amongst doctors is what happens if the Supreme Court overturns Roe versus Wade. She says that will drive women who need an abortion underground.
It should never be that people who would prefer to have abortion in a clinic with a healthcare provider helping them have to seek it on their own. We don't ask people to look for their own appendectomy. We shouldn't be asking people to look for their own abortion.
The law in Washington state actually protects women and providers here, even if Roe versus Wade is overturned at the federal level. But Dr. Prager says that globally it is well established that in places where abortion is illegal, they have increased rates of maternal mortality and that minority women almost always suffer disproportionately. From the King 5 newsroom, I'm Steve Bunin.